Hello, greeting to all. I am Dr. Irfan Ahmed, working as a medical lecturer in the microbiology, virology, and immunology department of the Samarkand State Medical University. So today we will going to discuss about the hepatitis viruses, which is very and most important topic of the microbiology. So characteristic of the human hepatitis viruses, there is a name and families which all the viruses following down. The hepatitis A virus is a pico RNA virus, hepatovirus 72. The size is 27 to 30 nanometer. Single strange RNA. Length of the incubation is 15 to 40 days. So mechanism of transmission is mostly fecal route. Vaccine is have yes. Hepatitis B virus, Hepatina varidae, Hepatinovirus 142 nanometer, circular, double standard, and DNA. The incubation period is 50 to 180 days. The mechanism of action is parenteral. Recommended recombinant subunit vaccination. Hepatitis C virus is flavi-RNA virus, 30 to 50 nanometer single cells. So this is the length of incubation is 4 to 28 days. Parenteral like other source. Vaccine have no. Hepatitis D virus unclassified, 35 to 40 nanometer single strand RNA. The 50 to 180 days. The parenteral transmissions. Hepatitis E virus, Calicivi viridae, 27 to 34 nanometer single strand RNA, 6 week oral fecal route, and there is no vaccine. The global prevalences of the hepatitis A infection. The hepatitis A vaccine, the hepatitis A virus is a family. The family is pico-RNA virus. Genus is a hepatovirus. Viron is 27 nanometer. Envelope is no. Genome is sRNA virus. Genome size is 7 to 5 kb. Stability is heat and acid stability. So the transmission is a fecal-oral route. The prevalence is high. Fulminant disease is rare. Chronic disease is never. Oncogenic is no. Hepatitis A virus is a particle found in the fecal extract by the immunoelectron microscopy. Both full and empty particles are the present. The virus is 27 to 29 nanometer in diameter. Here is the genome organization of the hepatitis A virus. Hepatitis A virus life cycle. The hepatitis A transmission, fecal-oral contamination of the food or water. The food handlers, raw, shellfish, travel to the endemic areas. Close personal contact, household or the sexual contact. Daycare center, bloodborne injecting drug users. For example, an epidemic of the hepatitis A virus that occurred in Shanghai, China in 1988, in which the 3 lakh people were infected. The virus resulted from the eating Anandra subcrinata obtained from the populated river. So pathogenesis. The pathogenesis of hepatitis A virus is replicates slowly in the liver without the producing the appearance cytopathological effects. In the absence of the cytolysis, the virus readily establish a persistent infection, jaundice, resulting from the damage to the liver. Antibody is detected and the cell-mediated immune response to the virus. Hepatitis A virus clinical feature, incubation period average the 30 days, range from the 15 to 50 days. Joined us by the age group less than 6 years, less than 10%, 6 to 14 years, 40%, 50%, and greater than the 14 years, 7 to 80%. Complication is a fulminant hepatitis, cholestatic hepatitis, relapsing hepatitis, chronic sequelae is a non. The concentration of the hepatitis A virus in the various body fluids, the feces most commonly, serum, saliva, and urine. Clinical variants of the hepatitis A infection. Asymptomatic, encentric disease. Children under 6 years of the age greater than 90. Children from the 6 to 14 years old 40 to 50%. Symptomatic. Icteric disease. Adult and children over the 14, 70, 80. A typical serological course of the acute hepatitis A virus infection. Hepatitis A vaccine efficacy studies. You can see the Havrix SKB2 dose 360 ELU, site of age Thailand 1 to 16 years, vaccine efficacy is 95% CL, 94% 79 to 99. Vacta Merck 1 dose 25 units, New York 2 to 16 years and 100% 85 to 100%. Hepatitis B virus, about the 300 million people worldwide are throughout that to be the carrier of the hepatitis B virus, and the many carriers eventually die of the result liver disease. Hepatitis B virus cause the acute hepatitis that can vary from the mild to self-limiting from the an aggressive and destructive disease leading to the post necrotic cirrhosis. Many hepatitis B virus infections are the asymptomatic, especially in the children. Prevalence of the hepatitis B serum antigen carrier state. You can see the hepatitis B virus, hepatitis B family hepatinovirus, genus is a orthohepatinovirus, viron is 42 nanometer, spherical, envelope is yes, genome is dsDNA, genome size is 3.2 kb, stability is acid sensitive, transmission is parenteral, and prevalence is high. Fulminant disease, chronic disease is often, oncogenic is yes. Fraction of the blood serum from the patient with the severe erase of the hepatitis, larger spherical particles are the dun particles are the 42 nanometer in diameter and are the complete hepatitis B virus. Also evident are the fulminant of the capsid protein. How many viruses reproduce? First, the virus attached to a liver cell membrane. The virus is then transported into the liver cells. The core particle then release its content of the DNA and DNA polymerase into the liver cell nucleus. Once within the cell nucleus of the hepatitis B, DNA causes the liver cell to produce via the messenger RNA hepatitis B protein, hepatitis C protein, DNA polymerase, the hepatitis B E protein, and the other undetected protein and enzyme. The DNA polymerase causes the liver cell to make copies of the hepatitis B DNA from the messenger RNA. The cell then assembles the live copies of the virus. However, because of the excess number of the surface protein produced, many of these thick and stick together, forms a small spherical and chain. These can give a characteristic ground glass appearance of the blood sample seen under the microscope. The copies of the virus and excess surface antigen are released from the liver cells membrane into the blood stream and form there can be infect the other liver cells. Hepatitis B virus replication. Reverse transcriptase, one of the messenger RNA is replicated with the reverse transcriptase, making the DNA that will eventually be the core of the progeniviron. The RNA intermediate hepatitis B virus replicate throughout the RNA intermediate and produces a release antigenic decoy particles. Integration: some DNA integrates into host genome, causing the carrier state. Open reading frames: there are four open reading frames derived from the same stranded, the incomplete stranded 3. The 3 polypeptide of the surface antigen pre S1, pre S2, and S3 produced from the alternative translocation start site. The C is a core protein, P is a polymerase, X is the trans-activator of the viral transcription and the cellular genes. The hepatitis B X is conserved in all the mammalian but not avian hepatinovirus throughout, not essential in the transfected cells, is required for the infection in the vivo. The antigen of the hepatitis B virus. Hepatitis B serum antigen surface coated protein, 4 phenotypes. Hepatitis B C A antigens inner coat protein. A single serotype hepatitis B E antigen is secreted protein, function unknown. Hepatitis B serum antigen, there are the some determinants which are the responsible for the 10 subtypes of this antigen. A is a A is a determinant is a general. There are D and Y and 2 additional W and R. So there are 4 main subtypes: ADW, AYW, ADRW and AYR. Other determinants: FG, and TX. Hepatitis B virus spread mainly by the parenteral route. Directly percutaneous inoculation of the infected serum or the plasma, indirectly through the cut or the abrasions, absorption throughout the mucosal surfaces, the absorption of the other infectious secretions, saliva and semen during the sex. Hepatitis B spread mainly by the parenteral route. Possible transfer via the inanimate environmental surfaces, vertical transmission soon after the childbirth, the transplacental transfer, rare, close, intimate contact with an infected person. Pathogenesis and immunity. Virus can enter the hepatocyte via the blood. Immune response for the cytotoxic T cells to viral antigens expressed on the hepatocyte cell surface responsible for the clinical syndrome. 5% become the chronic carrier. Hepatitis serum antigen greater than 6 months. High rate of the hepatocellular carcinoma in the chronic carriers, especially those who are a E single antigen positive. Hepatitis B surface antibody likely confirm the lifelong immunity. IgG and anti-HBs. Hepatitis B and AB indicate the low transmissibility. Who is at the greatest risk for the hepatitis B virus? Drug abusers, blood product recipients account for the 5 to 10%. Post transfusion hepatitis, hemodialysis patient, people from the Southeastern Asian countries, lab personals, the working with the blood products, sexually active homosexual persons with the multiple and frequent sex contact, medical dental procedures at personals. 3 lakh new cases in US per year. Lifetime risk for the average person is 5%. Sexual promiscuity risk, lifetime risk for the dentist is 13 to 28%. Jaundice. Characteristic of the hepatitis B infections is usually self-limiting, completing resolution in the 6 month. However, when the infected 5% adult chronic carriers, 20% is the children chronic carriers, 80 to 90% is neonate and infant become the chronic carriers. You can see the acute infection, hepatitis B virus DNA and hepatitis B serum antigen. Chronic infection practice, hepatitis B serum antigen nil, hepatitis C antibody total P, hepatitis S antibodies is P, hepatitis A virus IgM is N, hepatitis C virus N, past infection practice again, hepatitis B serum antigen is nil, hepatitis C antibody is total nil, hepatitis B serum antigen, hepatitis A virus IgG IgM nil, hepatitis C nil, immunization. The next scenario is hepatitis serum antigen present, hepatitis B serum antibody total is present, hepatitis B serum antibody is nil, hepatitis B IgM is nil, hepatitis C virus nil, may be acute or chronic. Order, hepatitis B core anti IgM are clarified. The IgM will be positive if acute. There is a vaccination, the name Angirex B, recommended and recombinant hepatitis B optional 2 dose. Combined hepatitis A and hepatitis B vaccine. Bivalent hepatitis A and hepatitis B vaccines. 1 ml contains 720 ELISA unit of the inactivated hepatitis A vaccines and 20 nanomicrogram of the recombinant hepatitis serum antigen protein. Dose is 1 ml of 0, 1 and 6 months. Recommended for all the susceptible persons greater than the 18 years at the risk of the exposure to the both hepatitis A virus and hepatitis B virus, including the travelers to the area of the high, intermediate, endemic and both viruses. Therapeutic agent is immune modulators like interferon, thymoxines, thermopeutic vaccines, nucleotide analog like lamivudine, adenovirus, emtecidovir, clevanidine, famciclovir. Characteristic of hepatitis C virus. The virus hepatitis C family is flavirna, genus Hepasivirus. Viron is 60 nanometers sphericals. Envelope is yes. Genome is RNA. Genome size is 9 to 4 kb. Stability is either sensitive, either acid sensitive. Transmission is parenteral. Prevalence is moderate. Fulminant disease. Chronic disease is often, and oncogenic is yes. Model of the human hepatitis virus. Lipid envelope capsid protein, nucleic acid envelope glycoprotein E2, envelope glycoprotein E1. You can see the structural and non-structural portion of the hepatitis C RNA structure. Hepatitis C is a global health problem, 170 to 200 million carrier worldwide. Prevalence in the group at the risk: recipient of the clotting factors, injection drugs users, long-term hemodialysis patient, blood priors, infant born, the infected mothers, long-term sexual partners, like that. The current likelihood of the transmission is a transfusion. Maternal infant, mother HIV negative, mother HIV positive is a 15 to 20%. Heterosexual partner in 1000 in one patient. Needle stick injury is hepatitis C virus positive source 5%, and hepatitis C virus status unknown is 1%. The hepatitis C virus accounts for the 90 to 95% of the post-transfusion hepatitis. risk of the sexual transmission lower than the for hepatitis B virus. Risk throughout the casual contact low. Vertical transmission position. Vertical transmission position. The risk increase if the mother is positive for the hepatitis C virus RNA. Risk increase if the mother is HIV positive. Overall prevalence is estimated is 1.4%. Who is the great risk for hepatitis? Who is the at great risk for the hepatitis C virus vaccines infections? The drug abusers, the blood products recipients, anti-HCV screening has greatly reduced risk. Hemodialysis patients, lab personals working with the blood products, sexually active homosexuals, persons with multiple and frequent sex contacts, medical dental personals via needle stick injuries. Natural history of the hepatitis C infections. You can see the chronic hepatitis C symptoms is vagueness, dry eyes, depression, anxiety, dry mouth. The pain and discomfort over the liver, poor appetite, indigestion, itching and rash, nausea and feeling sick, ache and pain in the muscle and joint. Diagnostic test for hepatitis C antibody test. Qualitative hepatitis C virus RNA test. Quantitative hepatitis C virus RNA test is a genotyping. Hepatitis C antibody test indicate the past or present infections. Inexpensive, sensitive and specific. The poor sensitive predictive value in low prevalence population. Low sensitivity in immunosuppressed patient. Qualitative hepatitis C virus RNA confirm the diagnosis of hepatitis C virus infection. Useful in the early diagnosis of acute hepatitis C. Demonstrate the presence of the active infection. The gold standard for the documenting response to the treatment. The potential hepatitis C therapies phase 1, phase 2 and phase 3. So you can see the characteristic of the hepatitis D virus. The family is unclassified. The genus Delta virus, viron is 35 nanometers spherical. Envelope is yes, genome is RNA, genome size is 1 to 7K, stability is acid sensitive, transmission is parenteral, prevalence is low regional, the fulminant disease, frequent, chronic disease and oncogenic is confused. Hepatitis D virus, the infections patterns, the co-infections acute simultaneously infections with hepatitis B virus and hepatitis D virus often result in the fulminant infections. 70% cirrhosis. Survivors rarely develop the chronic infection. Hepatitis D virus infection pattern is superinfection result in hepatitis D virus. Superinfection in an hepatitis serum antigen carrier can occur anytime during the chronic disease, usually result in the rapid progressive subacute or the chronic hepatitis. hepatitis D co-infection, hepatitis D superinfection, hepatitis D virus, which is oral, no. Transmission process is oral, is no. Percutaneous common, sexual is rare, perinatal is no. Incubation period is 21 to 45 days. Jaundice is unknown. Fulminant is 2 to 7.5%. Diagnostic test is acute infection is IgM and anti-DV. Chronic infection, immunoglobulin G and anti-HDV. Hepatitis B serum antigen. Immunity not applicable. Case fatality rate is 1 to 2%. Chronic infection, superinfection 80% and co-infection is 5%. Hepatitis E virus. Hepatitis E virus is a family is Calliciviridae. Is genus is unnamed. Viron is 30 to 32 nanometer. Icosahedral envelope is no. Genome is SSRNA. Genome size is 7 to 6 kb. Stability is heat stable. Transmission is fecal-oral. Prevalence is regional. Fulminant stage in a pregnancy. Chronic disease. Oncogenic, no. Epidemiology is suspected from the study of the waterborne hepatitis in India in 1980. Confirmed by the transmission to the chimp and human in 1983. Probably the account for the many historical outbreak of the hepatitis and endemic mainly in Asia, Middle East and North Africa. Epidemiology, fecal-oral transmission, contaminated water supplies in the tropical or the subtropical involved countries. Many young adults can infect the primates, swine, sheep and rats. Swine may be the reservoir of the infection in the North America. Maternal infant transmission occur and it's often similar to the hepatitis A, can cause the severe acute hepatitis. Subclinical infection is common. No chronic infection up to the 20% mortality among the pregnant women, especially the third trimester. Course of acute infection. Prevention. Passive immune serum globulins does not prevent the infection. Many hepatitis amyrolate active vaccines is anti-ORF to prevent the infection in the chimps and humans. Clinical trials in progress. Hepatitis E virus, oral not common transmission, percutaneous unknown, sexual no, perinatal yes, incubation period is 15 to 60, jaundice is common, fulminant less than 1%, pregnancy up to the 30%, diagnostic test is acute infection, IgG and anti-HEV, seroconversions, chronic infection not applicable, immunity is not applicable, case fatality rate is 0.5 to 4%, 1.5 to 21% in pregnant women, chronic infection non. Hepatitis G virus family is Flaviviridae, genus is unnamed, viron is 60 nanometers spherical, envelope is yes, genome is SSRNA, genome size is 9.4 kb, stability is either sensitive, transmission moderate, fulminant disease is yes, chronic disease is yes, oncogenic is maybe. Hepatitis G virus and GVBC share 95% amino acid identity, thus the represent different different isolate of the same human. The hepatitis C like virus, the classified in the Flaviviridae family, same as hepatitis C virus. The genetic organization similar to the hepatitis C virus, genome consistent of the single standard RNA molecule of the positive polarity. Hepatitis G virus epidemiology, transmissible by the blood and the blood product, present in the asymptomatic blood donors with the normal ALT levels, found in general populations, hemophilia patients, IV drugs, patient with a chronic hepatitis B, patient with a chronic hepatitis C. The recent clinical significance is hepatitis G virus is injection does not cause the acute hepatitis. Hepatitis G virus may establish the chronic infections frequently occur with the hepatitis B, C and hepatitis C virus infections may not qualify as a true hepatitis viruses. So we can simply discuss this kind of slide will tell us the importance of the hepatitis, which is also the decide the hepatitis virus is so much danger because have the strain, the hepatitis A, hepatitis B, C, D, E. The most commonly present hepatitis C virus in our community, which is also sometimes called the black hepatitis, which is very dangerous. So for the hepatitis C virus, we have the different kind of modality of the treatment, which is uh, which is the interferon alpha and the spospovir and interferon rabdovir. So that kind of medicines are the classical treatment, and the supportive treatment is fluid balance, minerals balance, protein balance, carbohydrate balance, lifestyle modification. So this is a basic lifestyle modification and treatment. Patient have to adopt such kind of changes in the diet and the activity, otherwise patient will face the very serious consequences. The topic is very simple and very quiet according to the slide. So you have to read carefully and get the clinical features which has been discussed in this lecture. So this lecture is going to be end with the final things is that uh, the hepatitis B virus is Engerex B, and hepatitis C virus is the interferon, and hepatitis A and hepatitis D is a similar activity and will cause a jaundice. Jaundice is the yellowness of the sclera, then will ultimately reach to the icterus, in which the human bilirubin level is so much increased due to the hepatocytes is destruction. So in that particular case, we will decide to which medicine we have to give the patient. So let's decide to that with the investigations, which is PCR and ALT and AST. So PCR is a qualitative and quantitative option is available there. So you can choose the PCR is a quantitative instead of the qualitative. So in quantity, the PCR is tell us the viral load. So how many viruses are already present in our body and how do we treat them and cope up them. So that's why this is very important. So we this lecture is going to be end and we will discuss on the some another video. Goodbye. to all.